Hi everybody, still Dr. A here, and we're going to continue our basics of pediatric testing, and we're going to look at the minerals. So we'll start with calcium. Normal ranges for newborns from 3 to 24 hours old is 9.0 to 10.6 milliequivalents per liter. From 24 to 48 hours old is going to be 7.0 to 12.0 milliequivalents per liter. And then from 4 to 7 days old is 9.0 to 10.9 milliequivalents per liter. So you can see there's some variations here, most likely adaptations from being born. And then in children, it's usually 8.8 to 10.8 milliequivalents per liter. So if you take the adult range and shift it up slightly, then that's your children range. And then for adolescents and adults, it's 8.4 to 10.2 milliequivalents per liter. So calcium plays an integral role in many physiological functions, including muscle contractions, neuromuscular nerve transmission, blood coagulation, bone metabolism, so you need calcium to grow strong bones, and regulation of endocrine functions. So calcium is used beyond just the bones. It's just so many, has so many different roles all over the body. Due to the growth that occurs during infancy and childhood, the bone masses increases faster than the body weight, so they have shifts in body composition. And compared to adults, urinary calcium excretion is higher in neonates and in premature infants. So you also have to know that throughout life, there's always bone modeling and remodeling and turnover, and so calcium is taken out and added into the bones all the time. Hypocalcemia, or low blood calcium levels in the blood, they most commonly occur in neonates, could be due to a variety of causes, including inadequate calcium intake, or hypoparathyroidism, vitamin D deficiency, renal failure, redistribution of the plasma calcium, or hypomagnesemia, or not enough magnesium in the blood. Hypercalcemia, or a high calcium level in the blood, is uncommon in the pediatric population, but if it is found, it could be caused by excess parathyroid hormone, excess vitamin D, excess calcium intake, or excess renal absorption of calcium, and increased calcium release from the bone. So there are other miscellaneous factors such as hypophosphatemia, or low phosphate levels in the blood, or adrenal insufficiency. Those can also impact calcium levels. Phosphorus. So now as a reminder, phosphorus is needed with calcium to grow bones. So normal ranges of phosphorus from newborns 0 to 5 days old is going to be 4.8 to 8.2, so much higher levels than adults. And this is in milligrams per deciliter. From 1 to 3 years is 3.8 to 6.5 milligrams per deciliter. Again, still higher than in adults. 4 to 11 years is 3.7 to 5.6 milligrams per deciliter. Still higher than adults, and then 12 to 15 years is going to be 2.9 to 5.4, again a little bit closer to adult levels, and a lot of times their growing period usually is leveling off. Of course, it depends between males and females. Males can still grow into the early 20s, and then from 16 to 19 years, 2.7 to 4.7, so like adult levels. So again, phosphorus, like calcium, it is essential for bone mineralization and for skeletal growth. And during infancy and childhood, proper growth requires a normal phosphorus level. So hypophosphatemia, not having enough phosphate in the blood, can occur due to increased renal excretion, decreased phosphate or vitamin D intake, and intracellular shifting. So phosphate. A lot of phosphate that can be used as intracellular buffer and other functions inside the cells. So, in premature infants, if they are fed regular infant formula versus preemie infant formula, phosphorus deficiency and rickets can occur. High phosphorus levels, so hyperphosphatemia, could be caused by decreased excretion of phosphorus, increased intake of phosphate or vitamin D, and a different shift in intracellular phosphate from inside the cells to outside of the cells, so the cell's dumping out a bunch of phosphate. The most common cause in the pediatric population is going to be renal failure. It can also occur if neonates are inappropriately given whole cow's milk instead of their formula. And magnesium, the normal ranges are going to be for newborns 0 to 6 days old, 1.2 to 2.6 milligrams per deciliter. That's actually pretty close. It's a little bit wider than the adult ranges, but it's pretty close. So 7 days to 2 years is 1.6 to 2.6 milligrams per deciliter. And 2 to 14 years is 1.5 to 2.3 milligrams per deciliter, and that's getting closer to the adult range. Magnesium plays an important role in neuromuscular function. It's a required cofactor for many enzyme systems in the body, and compared to adults, the immature neonatal kidneys tend to retain magnesium. So that's why we see little higher upper limits of normal in your normal ranges for magnesium. Hypomagnesemia, so low magnesium levels, could occur due to excessive renal or GI losses, decreased gastrointestinal absorption, so especially if the GI tract's really inflamed, or decreased intake. And so in a newborn, there can be several causes of hypomagnesemia from the pregnancy, so it's really from the mom not having enough, including if mom uses diuretics, if mom uses or overuses or abuses laxatives, if mom has diabetes, gestational diabetes, and if mom had a decreased intake due to vomiting. Some women suffer from hyperemesis gravidarum, which is basically like morning sickness and with vomiting that lasts the entire pregnancy. And then high magnesium levels, the most common cause in pediatric patients is going to be renal dysfunction. The most common cause in neonates is going to be the IV infusion of magnesium sulfate to the mother for the treatment of preeclampsia or eclampsia, and that is done to slow down or stop labor. So we give them, high amount of magnesium, so their levels can go from an average of 2.0 milliequivalents per liter in their blood to 6, 7, even 8 milliequivalents per liter. And therefore, babies can have high magnesium level if they're born to a mom that was treated with magnesium sulfate. So there you go. That wraps up our mineral. And do go and check out the renal and hematology values for pediatric population.